Hi, my name is Jennifer McGoldrick. I was diagnosed with breast cancer at age 29. I'm a survivor now at age 31, working as a nurse at Mayo Clinic. I remember getting out of the shower after working out and felt the lump. I acted immediately by calling my primary doctor, and she ordered a mammogram, ultrasound, and later a biopsy. After that, all came out. The radiologist was concerned of what he saw after the ultrasound. We did a couple different images of the mammogram, and he was still concerned. He even at that point said, he goes, "I think it's cancer." I called my mom and my brother and I couldn't believe it. I couldn't believe that this was happening to me at 29. That day he did do my biopsy. Once I got the biopsy results and confirmed it was breast cancer, I met with Dr. Wasif, my surgeon, and I had already decided I was going to do a double mastectomy. I realized I didn't want to have to deal with this again in another 30 years. I was too young, I thought, to have to even deal with this now. In January of 2011, I went off and had a double mastectomy. A week later, I decided that I couldn't look at myself without having volume, and I had also met with plastics and reconstruction, and Dr. Rebecca had placed implants, and I soon after that received my port. After I got my port placed, I met with Dr. Northfelt, and we decided on a chemo regime. That appointment was very surreal. He kind of laid out the lines of how it was going to go, signs and symptoms of reactions you can have with chemotherapy. Chemotherapy, after all, is a toxin in your body. They're trying to kill all the bad cells that this cancer has caused. And not only that, it just takes a complete toll on your body. Fatigue, nausea, vomiting are complete side effects, although Mayo has done a great job with controlling my nausea and vomiting with the chemotherapy. With that appointment with Dr. Northfelt, he also took me around the chemo units where I would be getting my chemotherapy and showed you around, introduced me to a couple of the nurses. Dr. Northfelt was just caring, compassionate, and thoughtful as he was dealing with me at 29 years old. I couldn't have expected a better physician to be on my side during this. So I worked full-time during the 4 out of my 6 cycles of chemotherapy until the fatigue really just hit me. So you can still continue to live somewhat of a normal life. And even during those last weeks of chemotherapy and into radiation, I still worked, although it was more along the lines of a light duty, where I did more desk work. And finally, I am working with cancer patients myself, and I find, joy telling them my story. They saw that I've had a port, they ask about it, and I tell them, and I tell them about my experience, and let them know that there is light at the end of the tunnel, because there really is. It may not seem like it, but there really is. My dad always said to me, and I hated this sentence, but he would always say, "One day at a time." one day at a time, and I hated it, but it's the very truth. I decided to go ahead and have radiation. My first radiation, I remember sitting or laying on the bed and thinking to myself, I can't believe I'm here. I can't believe I have to be here having radiation. And it just kind of all came back again, like the realization of what is going on, that I have breast cancer. Radiation was every single day, 5 days a week for 6 weeks. I ended up developing radiation burns, and I also, on top of that, the fatigue with chemotherapy. One of the social workers from radiation oncology, she sat down and spoke with my mom and I, and one thing that really stood out with that meeting was having deconditioning physical therapy, and I never even thought about that. So I soon asked my doctors to, consult physical therapy so that I can start again walking and start living my life again, and sort of start putting breast cancer behind. I am a survivor. I am passionate about finding a cure for breast cancer. I recently, a week after my recent surgery in October, I was out and about on the Komen walk. I did not walk, I still had drains, but I was in the Mayo booth helping spread the word about breast cancer. And I was tired after that. However, I wasn't going to let surgery, and I'm not going to let this cancer beat me down. So here I am today, 1 week out of my final reconstruction, no more port, and I'm here, I'm alive, and thankful that I have had the best treatment at Mayo, and thankful for my physicians there, Dr. Wassef, Dr. Northfelt, and Dr. Rebecca, and all the nurses and staff there. They have been amazing, and without the strength and support from them and my family and friends, I really am not quite sure I could have made it without them.